We are here today to present the new latest health care bill presented by Nancy Pelosi, Speaker of the House, yesterday. It is nearly 2,000 pages long, and we are presenting it to the library because we've had a number of requests already from people who want copies. We simply can't print off this many copies. Who want to be able to not just see it online, but be able to read it and feel it and sort of think about it. And this is such a huge issue that affects so many people's lives. We thought it was entirely appropriate that we be able to give it to the library so you can make it available to the public. I should tell you, this bill is 5 times larger than the Jewish Torah. It is $2.2 million a word is the cost of this, and if you want to start reading it today, it's equivalent of reading a new book every day for the next 8 days. So if you're going to do it all, digest it all, you're going to have to start now. And what's I think most frustrating is that, and I've been involved in healthcare reform for a long time, is that I can't find in this bill a way that we lower healthcare costs, that we make it more affordable for people. And that's really, I think, what we all want in healthcare reform, is to make it more affordable. I worry that this creates a lot of new government on top of a healthcare system that's already way too complicated. There are, in this bill, about $800 billion of new taxes and a little over $400 billion of cuts to Medicare for our senior programs. And I worry too, and I'm going to be visiting with our chambers of commerce here in about 30 minutes around our district, that it's going to force a lot of small businesses to drop their health care and push their workers into the government-run plan, which I don't think is good for the country, but the new mandates are going to make it tough for small businesses to do that. This costs, these 4 books, if they become law, will cost over $1 trillion to start. But the worry is, down the road, it's going to add, we think, billions of dollars to the deficit. On top of, we don't really pay yet for Medicare. That's going bankrupt in 6 years. Social Security, not too far behind. And we don't even really fund our VA the way this country should, in my view. So the cost of this is a worry at all, but we want to make sure the library had it, that the public can access it here by coming to the library. They can read it, and if they've got questions, call our office. We can, if we don't know the answer, we probably do, but if we don't, we'll get you an answer or somewhere in the government on how this works. So Jerry-Lynn, thanks for letting us provide it to the library. We hope people will take advantage of it, and even if it's just sections of it they have questions on, come read it and then come ask us about it.
Well, thank you so much. We're happy to have it. We understand that 2 additional copies are coming. We'll place one at the Central Library and one at our library in New Caney. And we've also placed a link to the PDF file and the text on our webpage so that individuals could get that information online as well.
Correct. Right. Questions?
Does the opt-out option that was presented by Senator Reid, does that make it any more palatable, in your opinion?
In the Senate, it may to 2 or 3 of the senators, but we don't know yet if that'll change their vote or not. There is no opt-out on the House side. It's all mandatory.
Okay.
So the taxes are mandatory, the mandates are mandatory, the new government public option is mandatory. In fact, they use shall how many times in this bill?
2,500?
25, a lot. We shall a lot in this bill. We tax. Tax is a word used very frequently in this bill. Require, tax, shall. This is very much a directive.
Have you had a chance to compare both versions at all, like some of the major points?
We've looked at a lot of it, but we're still doing our homework. It looks very much like the House bill that during August we had more than 50 town hall meetings about. The only difference is it's twice the size. It's even more government than when it started. And we haven't counted it up, but in August, the bill that was half this size had 31 new federal agencies, commissions, and mandates added to our healthcare system. We don't know what the number is, Nancy, yet on this one. We expect it to be big.
What hopes do you have, since there is a Democratic majority in Congress, what hopes do you have that it will get whittled down severely or just won't pass?
You know, I think it's going to be a tight, even though Democrats have a very large majority in the House and Senate, you know, I think it's going to be a very tight vote because a lot of people don't think this is the right way to go. But everyone agrees we need improved health care. I don't know a member of Congress, frankly, of the public either, that doesn't think we need to make some real changes. The question is this going to make health care better? And I think it's going to be very evenly divided. So we don't know, which is another reason why we wanted to present this today. We want the public to weigh in. I mean, this is the time, this rarely happens in our lifetimes, where you can have input into a bill that can change the future, really, of this country in many ways. And so the next 7 days is really an opportunity for the public to let their voices be heard. And we're encouraging them to talk to us, to talk to their member of Congress, to weigh in, and if they want to, start here at the library and read it themselves.
Right. Are you going to be having any more town hall meetings in the near future?
Between now and the Thursday vote, probably not, although we're going to do some telephone town hall meetings. We've got some listening sessions and conference calls going on with the small business community, physicians, hospitals, and we're starting, in fact, I'm going to do conference calls starting in about 20 minutes, but I know Sunday we're going to meet, it hasn't been determined where in the Houston region, but we're going to highlight in one tiny section of this bill, little provision that will effectively shut down 40 hospitals in Texas who are owned by physicians. These 40 hospitals, 2 of them here in Montgomery County, employ more than 15,000 people. But this provision picks a retroactive date, January 1st. In effect says if you weren't operating, you're no longer eligible for Medicare. And so that's hidden in this bill are a lot of things that concern us. We're going to be highlighting that, I know, Saturday or Sunday.
What are some of your biggest concerns that you have about the bill?
My biggest concern is that this won't lower health care costs. It will force a lot of people out of their plans and into the government-run plan. It's going to tax a lot of small businesses, I think, out of business. And at the end of the day, this is so expensive that it's going to add a huge burden onto our debt on top of the health care plans like Medicare and Social Security we can't pay for already. And to finalize the point, I think we can do better. I think there's a way that we can help small businesses give their people health care. I think there's a way we can lower costs and competition and lawsuit reform. I think there's some great ways we can improve health care, but most of those ideas aren't in here. Anything else?
That's on number of people who've called in who are for or against. I would imagine primarily against. Do y'all have those numbers, Tracy?
I don't have the stats, but it's overwhelmingly against, no question about it. In our district, both in our Democratic counties, we have 9 of them, in our Republican counties, we have 2. But all we really ask is that people take a look at this bill. Again, why we're here at the library. Take a look at it, think it through yourselves, give us your opinion on it. Good people disagree. You know, we reach different conclusions, but as long as we're all informed, that's a good place to start.
When is the first vote scheduled?
The first vote is scheduled, we think, for Thursday
Okay.
on this. Monday, they've introduced the bill. On Monday, they think they'll have the final version of it. It's called the Manager's Amendment,
Okay.
and we expect that to occur Monday. And then a vote, they have, to their credit, we've requested 72 hours for the country to see the final version. They're going to honor that. So we expect a vote Thursday or maybe Friday.
Okay, thank you.
Program for seniors. This cuts the Medicare Advantage plan dramatically, and we expect in Texas, of the 1 million seniors who have Medicare Advantage, about 650,000 of them will lose it. So that's a worry as well, is that the Medicare cuts are really going to have a price on our seniors. We're going to have cost.